Good afternoon, class. My name is Mrs. Ayeni Adremi Susan. I work in Lutz as Community Health Officer Tutor. I'll be lecturing you on role of community health officers in newborn care. The objective of this study is, at the completion of this section, you should be able to understand the role of community health officers in newborn care. The role of community health officers as a whole and their role in newborn care. The introduction. Community health officers has an important role in the care of the newborn, new babies. The community health officers work in the facility as well as in the community. Hence, they are very relevant in the continuum of care, that is, continuity in the care of their clients. They are expected to provide services that are beyond their scope of practice during emergencies, where health professionals are unavailable or referral may not be possible. And you know what is on ground in Nigeria? Task shifting and task sharing, where the health officers, the community health officers, work as adjuncts to the medical officers. What are the general functions of community health officers? I say there are three prominent roles representing the main functions of community health officers, which are: the first one is the clinical services in primary health care. Number one is first aid and treatment of simple and common ailments. What is first aid? Simply giving a prompt treatment in order to reduce or to prevent escalation of injury at a particular time or at the site of the events. When we're talking about first aid, we said community health officers has a role to give first aid to their clients. Why do you give first aid? What are the reasons for first aid? In order to preserve life, to prevent escalation of injury, to prevent infection from clients to the health officers or from clients to other community, and etc. Now we talk about treatment of simple and common ailments. Simple and common ailments. What are simple and common ailments? For example, somebody had wound dressing, malaria, cold, fever. All these are part of the roles of community health officers. They are maternal and child health. When you talk about maternal and child health, you know it is an essential role, especially in the primary health facility, because we are talking about community health officers that is bringing the health facilities to the rural settings, minimal area. Now, we now talk about maternal and child health, that is the health related to the mother and the child during pregnancy, after birth, and even prior. And when you're talking about primary health, when we're talking about maternal and child health, we're talking about preconceptional care, we're talking about antenatal care, we're talking about the care during labor, we're talking about the care postnatally, and we're talking about the care even after the child has started growing, and family planning inclusive. Referrals. You refer the patient when you know the facility is not enough or you don't have capable hands in managing your clients. Community health officers also do their record keeping. We normally talk about documentation in health practitioners. Now, when you don't document, when you don't have your document for whatsoever you've done, you can be litigated. And when you are trying to save yourself, you are also trying to make the record in case you are not available by the time the client comes for the next visit. Then collection of data on vital events, which is also related to research methodology. day in, day out, we're trying to learn new things. So you collect data, you present it for research methodology. Community services. It is expected of a community health officers to visit their clients, to give them home visits. You go to their homes in order to visit them, check on them, to know if they are following the regimen, if they are following the health education you've given on to them. And you know, environmental sanitation is important. If there is no home visit, there is no how you can know how their environment is. And when you get there, you have to also educate them on how to manage the environment, how to make the environment clean. We're talking about hygiene, personal hygiene and stuff. Then surveillance. You watch at least the occurrence of whatsoever you think can escalate or can bring in problem to the community. You also help in treating or managing communicable diseases. You help in controlling as well. You help in community development activities, whereby you do your community mobilizations. Then we move to health education and counseling, which is the major thing in the major role of a community health officer. Before you can manage your patient, before we even move to prevention, before we move to curative care, we talk about the preventive measure, and in which health education comes in and counseling. You educate your patient. And now we're talking about newborn care. That is to tell you, educate them on antenatal care. You give them education on care during labor, care after labor, family planning. Because the reason why we're talking about all this is because we want to reduce to the minimum the maternal and child mortality rates. Then you talk about nutrition, adequate nutrition. It is not about eating what you want to eat, but it is about balancing it, making it adequate for both the mother and the child. Then exclusive breastfeeding. Now when you talk about exclusive breastfeeding, you let your patient or your clients know about what we refer to as colostrum, which is the first breast milk secretion after birth. Research brought it out that it is nutritious, and it also builds immune against infection for the baby we're talking about. Now we continue with the roles of community health officers in newborn care. It is your role as a community health officer to counsel the mother and on the care of herself and the newborn in the community. And when you're talking about counseling the mother about her care, about the care of the child, it contains the personal hygiene. Because if there is no personal hygiene, if she lacks in personal hygiene, in handling the breast we are talking about, because we talked about exclusive breastfeeding, if she did not take care of her breast before giving it to the child, she can infect the child. If she did not handle the gadgets for feeding her baby, after 6 months, the baby can as well contact any ailment. If she herself did not take care of herself, then it means she's liable to contact disease or to die early. Now, I also make mention of family planning the other time, because it is very essential you introduce them to family planning so as to space their child, so that they will have time to rest before having another child. What is family planning? Family planning simply means giving chance for child spacing. And that is why it is essential we bring it to the community health level so as to help them in spacing their child. Then you, as a community health officers, you also help in assessing for danger signs in the newborn, in the facility and in the community. You need to assess the child being born. You need to assess, what are you assessing? You look at the danger signs. At times, the baby might be bluish in color, but asphyxia, jaundice, etc. And these are what you need to fish out so as to prevent neonatal mortality. Then as a community health officer, you also need to manage your patient. You also need to talk to your patient on adequate diet in order to enrich the nutrients of the baby during breastfeeding. Then you also assist them in preventing infection and reinfection processes. What do I mean? That is, you help them, you educate them on how they can prevent infection in the facility and even when they get home. For example, during care of the coach, you assure there is nothing like they putting GV, there is nothing like they using hot water or putting hot stone inside the clothes, massaging the umbilical cord. All this can introduce infection to the umbilical cord, and which, if you didn't educate your clients, that is the mother, she won't have the knowledge of this, and which will also make her to transmit infection to the child. From the slide you can see how the community health officer is managing the baby. The way she carry the baby, you carry the baby with care. You can see how she supported the baby's neck with the head on the scale. It's not as if she just carry and put the baby on the scale. She supported the baby, then after she has balanced it, she will now read the scale to give the weight of the baby at birth. Then as your duty, you also support the mother. You teach her, you educate her on breastfeeding, and you teach her on how to place the baby at the breast so as to provide sufficient milk for the baby during breastfeeding. In conclusion, the community health officers have an important role in newborn care, in the facility and in the community. Their relevance in newborn infections, prevention and control cannot be overemphasized. They are needed in the community, they are needed at the facility, they are needed everywhere. Thank you for listening to me.